It is Black History Month, and this morning we're looking into the barriers many people in the Black community say they face in getting help with their mental health.
Our Fox 4 Morning News anchor Lisa Greenberg is live from the David Lawrence Centers for Behavioral Health in Naples, where we're learning more about the training that goes on there. Good morning, Lisa.
Good morning, you guys. Yes, we are here talking about the different barriers that minority communities say they may face when it comes to getting access to mental health care. Right now here at the David Lawrence Center, they are holding an employee training. Part of that includes cultural diversity training, and we'll get to more on that in just a second. But this hour, we want to focus on the barrier of lack of resources and awareness.
In a report from the Florida Behavioral Health Association,
Florida ranked 43rd in the nation for access to care and access to affordable insurance.
And Sache Casares, an outpatient clinician at the David Lawrence Centers for Behavioral Health in Immokalee, says at the same time,
Black youth doubled the numbers of suicides from their white counterparts. And that's pre-pandemic, so I can only imagine what the numbers are post-pandemic. Which is a scary thought, to be honest with you.
And she says when you follow the funding.
In Collier County, for example, 2017, there were 57 completed suicides to 7 homicides. And those are two directions of funding that are completely opposite for each other. So when you recognize that there is an incredible need for mental health care to bring that 57 number down, it's interesting to me how that is being lost in translation.
Because of that, she says many people don't know where to go to get mental health care.
We talk more about that police chase, right? Versus a lot of people are completing suicide because X, Y, and Z. So I think that's a big reason why access to care is so limited.
She says in the last 30 years, there's been an 80% increase in Black youth suicide.
With virtually no changes with the white community in that same category. So it is something that really begs our attention.
You guys are here. You have a presence in this community, which is already in a way providing the access and striving to break the barrier. But is there anything that DLC does to actually go out into the community instead of someone who needs help having to seek you out?
Oh, absolutely, yes. We have a variety of community services where we're going not only to homes of those that need that, but also out in the community, whether it be schools or health fairs or whatever the case may be. We do have that outreach as well.
And here live at the David Lawrence Center, I have Angela Lopez with me this morning. She is the Director of Access and Outpatient Therapy Services here. And Angela, I want to talk a little bit about that cultural diversity training. They are in a training right now, the employees inside this classroom. I'll go ahead and have Travis give you a look at that. Trista, if you don't mind opening the door for him. Don't want to be too disruptive, so we'll go ahead and stay out here. But Angela, what goes into that cultural diversity training that happens?
Yeah, so we're actually very proud of our cultural diversity training that we offer. All of our new employees receive cultural diversity training. They also have access to be able to review and repeat that training as needed or as they really wish at any point during their time here. The real importance of having such a training is that as a behavioral health center, we really find that it's extremely important for our staff, all of our professionals, and all of our staff really here to be able to have the knowledge and the sensitivity to be able to work with every culture, people of various colors, and be able to be sensitive to their needs and the needs that they come in with.
Absolutely. And again, that's just part of the training that's happening here. One thing I wanted to talk about is Sache Casares, that outpatient clinician that the people at home just heard from, was saying she's part of revamping that training. What is that revamped training going to include?
Yes, so the thing that's really going to include that we're really excited about is including intergenerational trauma. So all of that generational trauma that people of color and other individuals and from different cultures have experienced is going to be included in here. And I think that's very important as a behavioral health setting to make sure that all of our staff are aware of the generational traumas that come with certain individuals that are experiencing perhaps symptoms and expressing distress over some of that.
And I know something that we were talking a lot about before we started this live segment was that you guys really have this priority of hiring clinicians that represent all races.
Yes, we absolutely. So currently we have individuals of various cultures. We have individuals that are from Haiti. We have individuals currently that are from the Bahamas, as well as Black Hispanics, African Americans. So we do employ individuals of various races and cultures as well.
Good to see that, especially because we talk so much about how people want to see themselves in their clinician and how that really helps them open up and be able to get the mental health care that they need. All right, Angela, thank you so much for joining me this morning. And coming up on Fox 4 Morning News at 10, we are going to talk about how cost is a barrier for a lot of people and what the David Lawrence Center does here to help with that. For now, I'm Lisa Greenberg. Back to you.